I'm your consumer investigator, Dale Cardwell, and you're watching TrustDale TV. With our expansion into health and wellness with TrustDaleHealth.com, we now have added the Good Health segment to every single show, and we're excited to bring that to you. And you can find new treatments and find quality providers, and we tackle the tough issues. Today, we are discussing a topic that you'll all find confusing, I'm sure: health insurance. Joining us to try to unravel that web is our own resident medical expert, Dr. Elaina George, who knows firsthand how health insurance impacts both the patient and the doctor. Hello, Dr. George. How are you?
Hey, Dale. Good to be back.
Thank you for being with us. First of all, what percentage of Americans actually have health insurance?
About 85% of the country is covered by health insurance. It's changed over the past several years. It's dropping, but it's still technically a majority of the country. I'm
surprised at that number. I thought it might have been actually lower than that. But so let's unravel this mystery. What's the difference between an HMO, a PPO, or a POS plan?
Well, there are basically three different types of health insurance. It's like a cafeteria. You can consider it that. The POS is the middle ground. HMO is the health maintenance organization, which means you have to go through gatekeepers before you can see specialists. There's a lot more hoops that you have to jump through to get health care, but the cost is lower. Premiums are lower and the out-of-pockets are lower. The other edge of it, or end of it, is the PPOs, which is the preferred service, where you can do what you want, go to a specialist if you so choose, and there's less having to go through your primary care doctor to get care. So it's basically a little bit more patient-friendly. If you decide you want to go in, you just do it. You don't have someone that you have to get approval from.
A lot less headache, but probably more expensive.
Absolutely. The out-of-pockets are definitely higher there.
So let's help us out with this. How do we choose between a high premium and more coverage versus low premiums and more out-of-pocket costs?
It comes down to the individual. I mean, you really have to decide, really look at your health situation very critically. How many times a year do you really think that you're needing to see the doctor? Somebody's young and healthy, barely, maybe they go once or twice a year. Something with a high deductible, low premiums would be ideal for that person. But if you have a medical problem that's chronic and you know that you have to take medications and see the doctor frequently, then you want to try to limit your out-of-pocket costs, and HMOs and POSs would be a better choice.
More and more people seem to not have health insurance or have high deductible plans. So how can they get affordable care?
It's interesting. There's a difference between health insurance and health care, and that's a very subtle difference, but people need to keep that in mind. Just because you have health insurance doesn't mean you're going to be able to afford to go to the doctor, because the premiums and the deductibles and the co-insurances, basically your out-of-pocket is so high. So my recommendation to my patients is to consider getting supplemental insurance, like AARP if you're a senior, or things like AFLAC, which will help you pay for your health insurance without you having to beg for it.
Yeah, well, great point. And what are some novel ways to get quality care that people may not know about?
This is probably the weirdest thing you'll probably hear a doctor say, but don't use your health insurance if you don't have to. If you go and you talk to your healthcare provider, go to surgery centers, and you say that, look, I want to know what is the deal you can make with me if I pay out of pocket, you're going to get a great deal, sometimes up to 70% off of what you think you're going to pay.
Isn't that an amazing symptom of how sick our system is, that people would rather just get paid than to have to go through the hassle of going through insurance?
Very true.
Wow. This is a topic we could discuss for a long, long time, especially with all the changes ahead this year. Thank you so much, Dr. George, for clarifying some of these insurance issues, and we look forward to seeing you next time on the show.
Absolutely.
Okay, fantastic, everybody. We have plenty more TrustDale TV ahead, including some very interesting tips that I'm pretty excited about. Find out what they are when we return.